Hi! It's a great day to be alive, isn't it? If you are a person with a disability, a caregiver, a family member, a friend, or someone interested in the disability lifestyle, you've come to the right place. Welcome to An Apple a Day, Living with a Disability. We're not only a podcast but also a resource and a community. This is the place where we will share experiences and learn from others as we overcome barriers and discuss the ways to live a happy, healthy life, not as disabled people but as people with disabilities. Welcome to the community.
Welcome to An Apple a Day's The Fritter. I'm Dave and I'll be filling in for Jimmy Apple today. He'll be back shortly. Jimmy's had several medical setbacks since the beginning of the year. I don't know how he keeps such a positive attitude. You know, the way he is on this podcast is the way he is in life. He truly believes that things can always be worse. Today I'll be sharing an overview of the disease known as ataxia. Ataxia is a neurological disorder characterized by a lack of voluntary coordination of muscle movements. It can affect various movements, creating difficulties with tasks such as walking, speaking, swallowing, and eye movement. Ataxia is not a single disease but rather a symptom that can result from various conditions affecting the cerebellum, the part of the brain responsible for coordinating movement, or its connections. Types of ataxia. Ataxia can be broadly classified into three categories: acquired, hereditary, and idiopathic. Acquired ataxia. This form of ataxia arises due to external factors such as injury, stroke, infections, or exposure to toxic substances like alcohol or certain medications. Other causes include vitamin deficiencies, particularly vitamin B12, or chronic conditions like multiple sclerosis or hypothyroidism. Hereditary ataxia. This category includes ataxias that are passed down through families due to genetic mutations. Some common types of hereditary ataxia are Friedreich's ataxia, an autosomal recessive disorder that typically begins in childhood or adolescence. It is caused by mutations in the FXN gene, leading to progressive damage to the nervous system. Spinocerebellar ataxia, SCA, a group of autosomal dominant disorders, with several subtypes caused by different genetic mutations. Symptoms and age of onset can vary widely. Ataxia telangiectasia, an autosomal recessive disorder that affects the nervous system, immune system, and other body systems. It typically appears in early childhood. Idiopathic ataxia. When the cause of ataxia cannot be determined despite thorough investigation, it is classified as idiopathic. This category includes conditions like multiple system atrophy, MSA, and sporadic ataxia. Symptoms of ataxia. The symptoms of ataxia can vary depending on the type and severity of the condition. Common symptoms include gait abnormalities, unsteady walking, and a tendency to stagger or fall. Poor coordination. Difficulty with tasks requiring fine motor skills, such as writing, buttoning a shirt, or using utensils. Speech difficulties. Slurred speech, dysarthria, and difficulty controlling the volume or rhythm of speech. Swallowing problems. Difficulty swallowing, dysphagia, which can lead to choking or aspiration. Eye movement abnormalities. Nystagmus, rapid, involuntary eye movements, double vision, or difficulty tracking moving objects. Diagnosis of ataxia. Diagnosing ataxia involves a comprehensive evaluation, including medical history and physical examination, assessing the patient's history, family history, and a thorough neurological examination. Imaging studies. MRI or CT scans to detect structural abnormalities in the brain and spinal cord. Genetic testing. Identifying specific genetic mutations associated with hereditary ataxias. Laboratory tests. Blood tests to check for metabolic or nutritional deficiencies, infections, or autoimmune conditions. Electromyography, EMG, and nerve conduction studies, assessing the electrical activity of muscles and the speed of nerve signals. Treatment and management of ataxia. Currently, there is no cure for ataxia, but various treatments can help manage symptoms and improve quality of life. These include medications to manage specific symptoms such as muscle spasms, tremors, or depression. In some cases, medications to address underlying conditions like hypothyroidism or multiple sclerosis may be necessary. Physical therapy. Exercises to improve strength, balance, and coordination. Physical therapy can help patients maintain mobility and reduce the risk of falls. Occupational therapy. Strategies to assist with daily activities and improve fine motor skills. Speech therapy. Techniques to improve speech clarity and swallowing function. Adaptive devices. Use of canes, walkers, or wheelchairs to enhance mobility and safety. Nutritional support. Ensuring adequate nutrition and managing swallowing difficulties. Living with ataxia. Living with ataxia can be challenging, but with appropriate support and management strategies, individuals can lead fulfilling lives. Support groups and counseling can provide emotional support and practical advice for patients and their families. Advances in genetic research hold promise for future treatments, potentially targeting the underlying causes of hereditary ataxias. Ongoing research is focused on understanding the genetic and molecular mechanisms of ataxia, which could lead to the development of targeted therapies. Clinical trials are investigating various approaches, including gene therapy, stem cell therapy, and neuroprotective drugs. Improved diagnostic techniques and early intervention strategies are also key areas of research. Ataxia encompasses a diverse group of disorders characterized by impaired coordination. While there is no cure, various treatments can help manage symptoms and improve quality of life. Continued research and advancements in genetic and molecular biology hold the potential for future breakthroughs in the diagnosis and treatment of ataxia. With comprehensive care and support, individuals with ataxia can achieve a better quality of life and greater independence. I hope you found this information interesting. Jimmy has plans to do a series on this disease in the near future. I'd like to thank you for stopping by today and remind you, things can always be worse. Right now, somebody is wishing they were in your position. Have a great rest of your day.
Hey, have you joined our Facebook group, Living with a Disability yet? No? What are you waiting for? People are chatting, having fun, asking and answering questions, sharing experiences and making friends. Don't be shy, stop on by. You'll be happy you did. Simply go to www.famousapple.com/group. You'll be glad you did. The address is in the show notes for this episode. Don't miss the next episode of An Apple a Day, Living with a Disability, where host Jimmy Apple delves into the realities of living with a disability. Gain insights, hear inspiring stories, and join the conversation. Tune in for valuable advice and support in navigating daily challenges. This is an important topic. Let's keep the conversation alive.